welcome to the second in our series of our domestic violence and interpersonal violence series. Today, welcome Lindsay and welcome everyone who's watching. Today we are going to talk about how health care or health, one's health, is impacted by interpersonal violence or domestic violence. And I would suspect that's a very huge topic because of the how stress can impact bodies and how other aspects of domestic violence and interpersonal violence can impact bodies. So Lindsay, we are all anxious and to hear and excited to hear how health is impacted by domestic violence. Welcome.
Thank you. So, the reason why I picked this topic for today is because it's actually Health Cares About Domestic Violence Day. So, this is a nationally recognized day. It's sort of started by an organization called Futures Without Violence, and they recognize it the second Wednesday in October every year to with the goal of talking about how intimate partner violence can impact the health of people who experience it, like you said, Rosalia, and also how the healthcare field, like us here, can help educate people and intervene. And we know, right, like people come to their healthcare providers to take care of themselves. And sometimes I think that we maybe think about that in a very limited way about, right, like I have a cough, I'll go to the doctor and get some medicine, that kind of stuff. But we know that like so much about your life impacts your health. And like you said, Rosalia, being in a relationship where there's intimate partner violence, there's a lot of stress involved in that. It also impacts how you take care of yourself, right? So are you going to the doctor regularly? Are you able to take your medication or do what you're supposed to do? So we know it can have a lot of effects. And the idea is that your healthcare provider can be a place where you can go to get support. Sometimes for people, their healthcare provider is a trusted person that they can talk to. We know that research shows that survivors are 4 times more likely to use an intervention after they've talked with their provider about abuse. It's recommended by a lot of like the CDC, Joint Commission, that we do talk about and screen for intimate partner violence in the healthcare setting.
So my first question then is access to health care, because we know that in situations where one domestic partner is using violence or control or some other method, then they are very reluctant to leave their partner in the room by themselves with a doctor or a healthcare provider. So I would imagine that would be the first hurdle. How does the VA Maryland healthcare system clinicians, how do they deal with such a situation? Or are they trained specifically to deal with this?
Yeah, I mean, we do for safety reasons. Like if there's another person present, we don't do the screening, right? Because that could cause issues. Or even if that person maybe isn't with you, isn't the person that's being violent, it could get back to them. Certainly, I think that being a healthcare setting, we can kind of be creative in ways to try to get folks alone, right? I used to work in the women's clinic, for example, and um, you know, people have to change to get like a pelvic exam, right? So we can maybe ask everyone to step out for a minute while they're doing that, or ask the partner to step out while a pelvic exam is being done, um, things like that. So I think that I will say that hasn't always been a huge barrier. We can hopefully usually figure out ways to kind of work around things, but that's something that we always try to be creative about because certainly if there's a partner that refuses to leave, that can raise a little bit of a question for us of kind of what's going on. So certainly in those cases, we would try to kind of utilize the context of healthcare to kind of figure out a way to get them to step away, right? Maybe it's just if someone has to go to the restroom to leave a urine sample, we have information, want to try to have information there, things like that. So yeah, I think it is really about sort of being being mindful of safety and also maybe getting a little bit creative with what we can do.
And so, let's talk about stress,
Mm-hmm.
because the myth about interpersonal violence is that it's always kind of like a war zone.
Mm-hmm.
But it sometimes the pressure or the exertion of trying to control someone is very subtle, but
Mm-hmm.
that still causes stress. So can you
Absolutely.
talk about how that impacts the body?
Yeah, I think, I think generally we know that if you're under like extreme stress for a long time, it's not good for you, right? Like it's bad for you physically. And I think to your point, we have this stereotype sometimes. Like if I talk about intimate partner violence and how it impacts your physical health, I think people would probably think of like injuries, right? They think of like if you've been hit and then you have a bruise or broken bones, that sort of thing. But even outside of like physical violence, right? If people are experiencing verbal, psychological violence, that control you're talking about, um, someone who's like talking down to you constantly, who's maybe making threats, whose um, mood is unpredictable. Like people always often use the term like they're walking on eggshells,
Hmm.
right?
Hmm.
Or they don't know what's going to walk in the door. Like that is a pretty high level of stress to be at on a regular basis, right? You're kind of maybe existing in that kind of like fight or flight space on a regular basis. Um, and then I think if you bring in other forms of like gaslighting, I think is a common thing that can come up, particularly when there's kind of verbal psychological abuse.
So let's define gaslighting, because I
Sure.
know a lot of people don't know what gaslighting is.
Yeah. I think gaslighting is kind of a term that's sort of taken off, but um, sort of on a basic level, gaslighting is an ongoing pattern of behavior to make you question your own reality, right? So I think if you take the source material, right, is an old movie called Gaslight, in which the husband was like making changes to the home, right, like changing the light bulbs so they're dimmer. And when his wife was like, "It's darker in here," he's like, "No, it's not. What are you talking about?" And it's like an ongoing campaign kind of thing. So I that's thank you for saying that because I think that's important. I think sometimes whatever we hear on like TikTok maybe isn't always the accurate thing, but yeah, it's an ongoing effort to make someone doubt their own reality, and being on the receiving end of that can be really destabilizing, right? Because you don't really know like what's going on, you don't know if you can trust your own perception of things, and again, like that's a source of stress.
Hmm. I would imagine it would be, especially if you know something to be true
Mm-hmm.
inside your body and in your mind, but somebody else is telling you that no, you're crazy. That's not true. Why are you're imagining that and stuff?
Mm-hmm. Mm-hmm. Yeah, absolutely. And I think that's also part of the reason that the, I think in addition to physical impacts that the stress can have, there's a lot of psychological and emotional impacts too, that can be difficult to deal with, and that I think sometimes make the whole experience just that much more difficult. Um, and and yeah, I think again that might impact your health behaviors too, right? If you're like, I think I'm like not feeling well, and someone tells you you're wrong, everything is fine, then maybe you're not going to go to the doctor for
Mhm.
things that seem like they might be an issue, and that affects your health too.
And so what are so we talked about stress, the stress from gaslighting, and I want to say something about verbal abuse,
Mm-hmm.
because I've read a number of articles that said verbal abuse is akin to a physical beating, except there are no scars. So can you talk about the impact of verbal abuse, the name calling and the enraged speech patterns? How does that impact health?
Mm-hmm. Yeah, I think that it definitely can have similar impacts, right? I think that fight or flight response can still come up, right? If someone is yelling at you, right? If they're speaking at a high volume, maybe like in your face, imposing in that way, like that can still arise some of those same same feelings of fear and stress, that because you also don't really know like if that's going to escalate to physical aggression, right? um, I think it could also have a really deleterious impact on your self-esteem and kind of self-image, right? If you're hearing insults constantly, it is hard to like not absorb some of that, right? So I think it has a lot. It has similar kind of fight or flight response the way that physical violence could, and I think it also really impacts mental health wise, right? Your self esteem can be feelings of like depression and sadness, right? Those sorts of impacts are really significant too, and I think sometimes those can be really hard to like disentangle from, right? I think sometimes when you hear like negative messages, when you hear threats, when you hear belittling language, insults, those things can be really hard to like shake off.
So, is there a correlation between IPV or domestic violence with suicide risk?
Yeah, absolutely. That is something that can be increased for someone who's experiencing intimate partner violence. I think for a few different reasons. One, like I mentioned, if someone's experiencing feelings of depression, certainly experience of intimate partner violence can exacerbate any kind of existing like mental health concerns,
Mhm.
right? So if you're already dealing with like depression, anxiety, PTSD, experiencing intimate partner violence can just make those things worse, or you can, develop symptoms of those things. And we know that if you're really struggling with a mental health condition, that you might be more likely to, experience thoughts of suicide. Um, and sometimes people who are experiencing intimate partner violence might feel like they're in a situation that they can't get out of. Certainly, we want people to know that like that's what we're here to help with. But if people can kind of get to a sense of hopelessness, then that can also be a risk there too.
And then finally, can we talk about the health impacts of domestic violence when violence is actually employed or deployed, whether
Mm-hmm.
it's hitting or beating, like choking? What are those health impacts? Can a doctor recognize, or a clinician or a nurse practitioner recognize signs without a patient saying anything about it? And are they? Um, I know that some areas have laws where they have to report. So does that happen as well? So can you talk about that whole other end of the spectrum?
Sure. Yeah. So when there's physical violence, I think, like I said, sort of what we often think of is kind of bruises and broken bones, which, if someone's hitting you, throwing things, slamming you against things, like those are the kind of injuries that we would see, right? Sort of skeletal injuries, bruising. Um, when it comes to strangulation, that can have a lot of pretty serious health impacts. Because if you're depriving oxygen to the brain, that can be really, really dangerous, whether you intend it to be or not. So that's actually something that, when we ask people in the screening, one of our like sort of risk questions is, has your partner ever choked or strangled you? Because that is something that is kind of a big sort of red flag alarm bells for us, because we know that your the chances of being killed in a relationship if you've been strangled are much higher. Again, just because even if that's not the person's intention, because that there's just it can be so dangerous. Some people also experience like traumatic brain injury, right? If your head is hit or slammed against something, then you can experience like concussion or other kind of brain injury related things. So, in terms of providers assessing for those things, I think sometimes it depends on the particular injuries. I think generally something that providers look out for, that like kind of we encourage providers to look out for, is just if maybe the presentation doesn't necessarily like match up with what the patient is saying, right? Like if they describe oh, I got injured in this way and it doesn't really match up with what you're seeing, that's something that we encourage folks to look out for. Um, and definitely to, especially if you're seeing anything that happened, again, like hands around the neck, head injuries, like those are ones that we want to be especially attentive to. And then the last thing you said about reporting. So I'm sure that people know that there are many things that healthcare providers, so that's like the doctors, nurses, social workers, psychologists, are mandated reporters for. It varies by state. So I'll speak for sort of what it's like here in Maryland, but we have to report uh, abuse or possible abuse of children and of vulnerable adults. So that means adults who are typically like older, disabled, kind of unable to care for themselves. So if an adult who's not vulnerable in any way, just like an adult, experiences intimate partner violence, that's not something that we report. Certainly, anyone experiencing violence is very welcome to report to the police, but that's not something that we have to do. So if you come to get care and you don't want it to be reported to the police or anybody, then that doesn't have to happen. We can provide care, we can provide resources, and it doesn't have to be reported to the police, law enforcement, any of those reporting bodies. Certainly, if there's like a child involved that's getting harmed or like a vulnerable adult that's getting harmed, those are things we do have to report. But I think generally, intimate partner violence, kind of in and of itself, is not something that has to be reported.
So people, veterans who are either using violence or the recipient of violence are can confidently come and seek help without any kind of legal ramifications later. They're actually, you know, and then the other aspect to domestic violence impact on health, especially for women, is pregnancy. Can you
Yes.
talk a little about pregnancy and domestic violence? Is pregnancy used as a form of control, or does getting pregnant put a woman at a higher risk of, like, not being able to access prenatal care? So, can you talk about that whole aspect?
Absolutely. So we do know that pregnancy is a particularly vulnerable time. Research and kind of data shows us that intimate partner violence can begin or worsen during pregnancy. We also know that homicide is one of the leading causes of death for pregnant women in this state and this country. We also know too that like reproductive coercion is another form of intimate partner violence. So sometimes this might involve like a partner sabotaging birth control, forcing you to use like birth control or refusing to use it when you want to, kind of forcing someone to carry on or terminate a pregnancy. So kind of trying to control that aspect of life. And for people who, experience intimate partner violence during pregnancy, there's a lot of, people might delay access to prenatal care or might not have access to prenatal care, like you said, Rosalia, which of course is important for both their health and the health of their child. They can experience complications during pregnancy, sometimes bleeding during pregnancy, sometimes premature labor and birth. Obviously, if you're experiencing physical violence, there's potential injury to the fetus. In addition to the pregnant person, they might experience like miscarriage, stillbirth, or low birth weight when they do give birth. There's also some data that suggests that like, health behaviors during pregnancy, smoking during pregnancy might be more likely if you're experiencing intimate partner violence. So it definitely can be, and this is certainly not to say that anyone who's pregnant is going to experience this, but it definitely can be a higher risk, and it's a very vulnerable time. So it's definitely a population that we want to make sure of. And our maternity team here is great. Whenever our veterans are pregnant, they're being screened to see if they're experiencing intimate partner violence, so that we can, kind of keep an eye and make sure that they're safe throughout their pregnancy.
Well, this has been very illuminating. I'm sure that people, like, it was a little surprising to hear that reproductive coercion in either direction is a form of domestic or interpersonal violence. Whether to use pregnancy as a form of control or to prevent someone from becoming pregnant, it works both ways. So overall, what do you want veterans to know about domestic violence and seeking care, health care in general, and health care at the VA?
Yeah. I think in general, it's just important to know that it does have an impact on your health. I think sometimes maybe when we ask these screening questions, it doesn't always feel intuitive. Like, I'm here at the doctor, why does it matter about my relationship, right? But we know that if you're in a relationship that's unhealthy, that's abusive, that's violent, that impacts your health, right? Maybe it's your blood pressure, your blood sugar, maybe it's your migraines, you have this chronic pain or stomach issues that you don't really have a cause for, but you're experiencing this at home, right? Those are things that do matter. The feelings of depression and anxiety, the eating disorders, like these things play into each other. And so I think the important thing for me that people take away just is that, like, this is something that we care about, right? And so if it's something you're experiencing and you're not really sure what to do, the VA is a place that you can seek support. You can seek help. We'll ask you about it in your primary care appointments. Maybe you don't feel comfortable saying something then, but I hope that you can kind of at least take the information from that like, this is when we screen you and you hear these questions, these are some of the behaviors to look out for. And just know that, like, this is a place that cares about it. This is a place you can get support if you need it.
All right. Well, I think that's it. So the takeaway is, if you're a veteran and you are either experiencing as a recipient or as a user of domestic violence or interpersonal violence, VA is here to help. And Lindsay Wilson, who is our IPV coordinator, can connect you to any of the clinicians that you need to handle any situation.
Yeah, absolutely. Absolutely. And there's no wrong door. So just like I said last week, talk to your providers, give me a call. We can put my information in the comments again. But yeah, if you need support in this area, please reach out.
Okay, and you want to give us a little sneak peek of what our next Wednesday show is about?
Yes. Our next one is about, I believe, we are talking about red flags and warning signs of potentially abusive relationships.
And that's something that we're all interested in, especially people who are just dating and who are trying to determine if someone is right for them, how to be able to discern if someone has some hidden peccadillos.
Yeah, absolutely. Things to look out for sure.
Yes. Well, thank you so much for joining. Thank you to everyone who is watching. Thank you for the like. We really appreciate it. And we will talk to you next Wednesday at 2:00. Bye-bye, you all.
Bye.